Disturbing data from Nigeria paints a grim picture for people with HIV/AIDS. The 2021 Stigma Index reveals that approximately 25% of adults and 22% of young adults with the condition have faced discrimination, including malicious gossip, verbal abuse, and exclusion from social circles.
Can drive our hate, and that is the key message that I resonate with all of our particular.
Responding to these troubling statistics, the Joint UN Programme on HIV/AIDS, or UNAIDS, is mobilizing global support to collaborate with stakeholders in Nigeria. Their aim is to safeguard the rights of people living with HIV/AIDS, who are known by the acronym PLWHA. One resilient voice in this fight is a man who was diagnosed with HIV in 2005 and has faced discrimination and rejection almost ever since. Surviving the ordeal, Aaron Sunday is now a leading advocate of change.
Stigma is a death threat. Many of us will be confident and live openly if the society accepts us the way we are and for who we are. It is the value we contribute, not the status that we carry.
Nigeria has seen significant progress in its bid to end AIDS as a public health threat, with a 40% decrease in new infections and a 50% reduction in deaths linked to HIV/AIDS. However, according to UNAIDS, despite awareness campaigns and legal advances, discrimination remains prevalent, especially in the workplace, and this is seen as detrimental to the goal of eliminating the virus and disease.
Stigma and discrimination in the context of the AIDS response will increase people's vulnerability. It will deter people, so to having access to services, so you may have health facilities around, you may have drugs, but because of the stigma and discrimination, especially from the healthcare professional, so they would not have access to those services. They would not take the pills, they would not be virally suppressed, and then they would die, or they continue in transmitting the infection.
Authorities say they would like to see zero tolerance for discrimination against people living with HIV/AIDS, and they believe tackling the issue in the workplace is the best arena to start. Experts say Nigeria is leaving no stone unturned in eradicating structural, legal, and institutional bias against people living with HIV and AIDS.
We want to make sure by next year we attain 95, 95, 95. And we are determined to see that happen.
However, while there's a lot of work done, there's plenty more to do. As Nigeria moves towards its HIV elimination goal, 18 states are yet to enact laws against stigmatization and discrimination. UNAIDS and other key players are advocating the implementation of legislations upholding the rights of every individual, regardless of their HIV status. They're urging the swift repeal of laws violating fundamental human rights. The collaborative efforts of the United Nations and Nigeria are crucial in ensuring the future where every individual, irrespective of their HIV status, is treated with dignity and respect. Kelechi Emekalam, CGTN, Abuja, Nigeria.